You've decided you're ready to become a parent, and suddenly you're overwhelmed with people who feel they have the right to inform you on the correct way to conceive, give birth, what fears you should have, and the proper way to parent. How do you filter through the opinions? How do you know what's trustworthy information and what's a myth or just plain outdated? Welcome to the Birthies podcast. Join your host Michelle Smith and her guests as they cut through the noise and fear by sharing valuable tips, tools, and proven methods that help you connect with your own inner wisdom as you navigate the sacred journey that is pregnancy, birth, and parenthood in a more relaxed and confident manner. This podcast does not constitute, nor is it intended, as medical advice.
Hello, Birthies families. Welcome to your reprieve from the noise and the stress that can often accompany pregnancy, birth, and parenthood. I'm your host, Michelle Smith. As I contemplated what to explore in this second episode, I realized that in my intention to create a reprieve for families, it would be important to begin by addressing what I mean by noise and delve into exactly what stress is and how it impacts us. In the following episode, I will be discussing ways to help cope with and mitigate stress and provide a guided relaxation session as well. To begin, there's so much good information available to us these days, and that wasn't the case in previous generations. When I had my first child over 30 years ago, the information was limited and Lamaze classes were just starting to really become popular. And these days we can learn just about anything at the touch of a finger. And while this is amazing and even liberating, it also brings confusion and overload. I feel like we often question, who do I believe? What information can I trust? There is such a plethora of information coming at us from every direction, often unsolicited and vying for our attention. For myself, I often feel that there's just too much noise. Far too many opinions outside of ourselves constantly shouting at us how to feel, what to believe, what to be afraid of. All of this can create stress or add to our tension. It can create fear and even a sense of perceived threat, sometimes even constant perceived threat. And when it comes to pregnancy and birth, there is so much conflicting and even scary information. It becomes easy to feel overwhelmed and unsure, and sometimes stressed. We really need to stop scaring pregnant women. And as I've worked with families over the years, my focus has really become the importance of reducing fear and stress for families throughout their parenting journey. And I want to begin by reassuring you that stress affects us all. You may notice symptoms of stress when navigating traffic, caring for your children, during hectic times at work, managing your finances, coping with a challenging relationship, or for those of us here in Central Florida, as I'm recording this past week has been incredibly stressful with Hurricane Dorian. We aren't sure if it's going to impact us here in Central Florida. We're worried about the people on the coast, and it's created a tremendous amount of stress for us that can't be avoided. So stress is everywhere. And some stress is normal during pregnancy, and it's to be expected, after all, with the extreme changes that pregnancy and parenthood bring. A little stress is okay. In fact, some stress is actually beneficial. It helps build resiliency. And the good news is that short bursts of stress are not harmful to you or your baby. Our bodies are designed to handle small doses of stress. It's chronic, ongoing stress that is potentially damaging. Too much stress can wear you down and make you sick, both mentally and physically. We're not equipped to handle long-term, chronic stress without ill consequences. Unfortunately, Most of us are so used to being stressed, we often don't know how much stress we are under until we are at the breaking point. Stress can also mean different things to different people. What causes stress in one person may be of little concern to another. Some people are better able to handle stress than others. And again, this hurricane preparation has been a good example. Some people are really cooperative, and other people become very single-minded and can even become combative. In fact, recently, one of my pregnant mamas experienced being scowled at by someone in the store as she was placing a few cases of bottled water in her cart to prepare for the hurricane. Here this woman is very pregnant with a almost 2-year-old on her hip, and because she put more than one case of bottled water into her cart, this other shopper is standing there scowling at her instead of offering to help her. Again, some people can handle stress better than others. So exactly what is stress? Stress is the body's reaction to harmful situations, whether they are real or perceived. And that's important because perceived threat can cause stress as well. When you feel threatened, a chemical reaction occurs in your body that allows you to act in a way to prevent injury. This is known as the flight or fight or the stress response. Again, not all stress is bad. In small doses, stress can help you accomplish tasks and prevent you from getting hurt. The flight or fight stress response occurs naturally when we perceive that we are under excessive pressure, and it's designed to keep us safe. When we perceive a threat, the amygdala sends a distress signal to the part of our brain that controls the nervous system. Our sympathetic nervous system becomes immediately engaged in creating a number of physiological changes and begins by flooding the body with adrenaline. This increase in adrenaline forces our heart to beat faster. It pushes blood to the heart, the lungs, and limbs. This is to prepare us for the oncoming danger. It also takes blood away from non-essential organs such as the stomach. As more blood is being pumped around the body, we receive additional oxygen, which increases our senses. Our lungs expand to increase our capacity for breathing. We are more alert. Our pupils widen, taking in more light, and our hearing is sensitized. The extra adrenaline also triggers the release of glucose and fats from reserves in our body. This gives us more energy. All this energy and adrenaline can cause us to shake or tremble. We might even start to sweat. All of that works together to enable us to fight or flee from a stressful or dangerous situation. It is common for individuals experiencing the flight, fight, or freeze response to describe uncomfortable physiological changes like muscle tension, headache, upset stomach, racing heartbeat, and shallow breathing. We have all felt some or all of these symptoms when we've had to slam on the brakes while driving to avoid hitting the car in front of us. It sharpens our awareness to deal with the situation at hand. If you can address the stress and move on, your stress response will recede and the body will go back into balance. So again, for those of us here in Central Florida, because Hurricane Dorian has been so unpredictable and has created such a cone of uncertainty in its movements, we are under this feeling of constant perceived threat. We don't know when it's going to hit. It keeps getting delayed. We're concerned because of the people that have been devastated in the Bahamas. And so we're unable to return to balance because we're still under this perceived threat. And again, the flight, fight, or freeze response is beautifully designed to protect us in times of danger. Yet it can become harmful when elicited frequently. It's not uncommon in our hectic world for most people to be in an almost constant state of stress or flight or fight. In the media, the influx of opinions and fears surrounding us can cause us to be in a state of almost constant perceived threat. Stress can affect all aspects of your life, including your emotions, behaviors, thinking ability, and physical health. No part of the body is immune. According to WebMD, emotional symptoms of stress include becoming easily agitated, frustrated, and moody, feeling overwhelmed, like you are losing control or need to take control, having difficulty relaxing and quieting your mind, feeling bad about yourself, perhaps feeling lonely, worthless, and depressed, experiencing those feelings of low self-esteem. Avoiding others is sometimes a coping strategy. Physical symptoms of stress include headaches, upset stomach, including diarrhea, constipation, and nausea, aches, pains, and tense muscles, chest pain and rapid heartbeat, insomnia, frequent colds and infections, loss of sexual desire and/or ability, nervousness and shaking, ringing in the ear, cold or sweaty hands and feet, dry mouth and difficulty swallowing, clenched jaw and grinding of the teeth. Cognitive symptoms of stress include constant worrying, racing thoughts, forgetfulness and disorganization, inability to focus, poor judgment, being pessimistic or seeing only the negative side of things. Behavioral symptoms of stress include changes in appetite, either not eating or eating too much, procrastinating and avoiding responsibilities, increased use of alcohol, drugs, or cigarettes, exhibiting more nervous behaviors such as nail biting, fidgeting, and pacing. So what are the consequences of long-term stress? When high levels of stress hormones are secreted often, they can contribute to a number of stress-related medical conditions. It is estimated 75 to 90% of illnesses are related to chronic stress, such as mental health problems, such as depression, anxiety, and personality disorders, cardiovascular disease, including heart disease, high blood pressure, abnormal heart rhythms, heart attacks, and stroke, obesity, and other eating disorders, skin and hair problems, such as acne, psoriasis, and eczema, and permanent hair loss, gastrointestinal problems such as GERD, gastritis, ulcerative colitis, and irritable colon, menstrual problems, sexual dysfunction such as impotence and premature ejaculation in men, and loss of sexual desire in both men and women. If long-term stress can affect our sexual and reproductive health, it stands to reason that stress can impact our fertility. It is as if extreme stress relays the message to the body that now is not an appropriate time to become pregnant. Dr. Thomas Fernie explains that from a psychobiological level, one of the problems with stress is that it constricts the smooth muscles which surround the fallopian tube. The fallopian tubes lead from the ovary to the uterus. That is the passage through which the sperm has to travel in order to impregnate the ovum. The fallopian tube is incredibly small in circumference to begin with, and it can very easily shut down. When those smooth muscles contract due to stress because of the adrenaline that is being poured out, no sperm can get through. He believes that it is one of the contributing factors as to why women that are stressed have difficulty conceiving. According to an article authored by Alice Domar, PhD, in the journal Dialogues in Neuroscience in 2018, she says, in a similar study on 501 women in the United States, the levels of salivary alpha amylase, a biomarker of stress, were significantly correlated with time to pregnancy, Women in the highest quartile of amylase levels at baseline were twice as likely to subsequently experience infertility. Finally, in a recent study in 135 IVF patients, cortisol was measured through samplings of hair, which measured levels from the prior 3 to 6 months. The hair cortisol levels were significantly correlated to pregnancy rates. These findings match what most infertility patients believe, that psychological symptoms have a negative impact on fertility. However, the relationship between distress and infertility may not have a clear cause and effect direction, since women can and often do get pregnant even under intense stress, for example in times of war. Alice Domar says, "I suspect that some women are more reproductively sensitive to stress than other women. If you are stressed and you don't get pregnant quickly, then you get more stressed." She cites evidence from a study in Taiwan in which 40% of participants seeking infertility treatment were diagnosed with depression or anxiety. The treatment itself can be stressful, adding even more uncertainty, she says. It really does seem to be the classic question of which came first, the chicken or the egg. Does infertility cause stress, or does stress cause infertility? Is it a combination of both? It is estimated that 1 in 8 couples have trouble getting pregnant or sustaining a pregnancy. There is a silence that surrounds infertility, since the majority of women are reluctant to share their story with family or friends. Women who are struggling to conceive express feelings of shame, guilt, isolation, loss of control, and low self-esteem. These negative feelings may lead to varying degrees of depression, anxiety, distress, and a poor quality of life. I was surprised to learn that the depression levels in patients with infertility have been compared with patients who have been diagnosed with cancer. The most recent research has documented the efficacy of psychological interventions in lowering physiological distress such as anxiety and depression, and is associated with significant increases in pregnancy rates. Researchers like Sarah Berga, who heads the Department of Gynecology and Obstetrics at Emory University School of Medicine, and her colleagues studied women who had stopped ovulating for more than 6 months, and they found that they had high levels of cortisol, a stress hormone. In stressful situations, cortisol, like adrenaline, pushes metabolism into high gear. Sustained high levels can raise blood pressure and cause weight gain, or lead to other health problems. In a small study Berga published in 2003, 7 out of 8 participants who received stress management therapy began ovulating again versus 2 out of 8 who had no intervention to combat stress. A third Cochrane review in 2016 included 12 studies, of which 7 of those studies were intervention designs. The conclusions based upon these 7 studies were that physiological interventions were associated with less psychological distress, higher pregnancy rates, and improved marital satisfaction. Once a woman has conceived, some stress is to be expected after all, with the extreme changes that a positive pregnancy test brings. Though most often these changes are welcome, the impacts a baby brings into her life, relationship, and family can be overwhelming at times. Women can experience an emotional roller coaster with all of the hormonal changes taking place, which can make handling normal day-to-day stress more difficult. Trouble sleeping can compound this even more. The pregnancy itself is taxing on her body, and that in itself creates an element of stress. It is truly incredible the amount of change and growth that takes place within our bodies and our developing baby in the span of 9 months. Women will naturally experience some discomfort that a growing belly brings. For some, the effect will feel minor, while other expecting mothers can really struggle with nausea, heartburn, constipation, extreme fatigue, backache, lack of sleep, and more. Some women may experience additional stressors such as gestational diabetes, preeclampsia, or a high-risk pregnancy. Most women are dealing with all of this normal natural stress that pregnancy brings while working full-time. She will have to manage job responsibilities and prepare her employer for time away from her job, which brings its own set of stressors. If she has other children as well, things can feel overwhelming at times. She can become anxious and concerned about how she will be able to juggle it all. Unfortunately, pregnancy and birth are typically shrouded in fear and misinformation from movies, television shows, media, as well as the opinions of friends, family, and even strangers. Women may be worried about what to expect during pregnancy, labor, and birth, or how to care for her baby. For many pregnant women, the task of navigating the U.S. medical system can contribute to her stress levels, since healthy pregnancies are often treated as a disease instead of a normal physiological process. The medical system can at times also strip a woman of her autonomy and the right to be heard. Fearful thoughts and doubts about her ability to give birth can cause her to feel as if she's under constant perceived threat. For some women, these feelings of constant perceived threat to themselves and or their babies can place them in a state of flight or fight or even freeze. This can be especially profound for families that have endured acute stress, fertility struggles, miscarriage, perinatal loss, or a previous traumatic birth experience. Research shows that short-term stress situations, however, do not seem to have an unfavorable effect on the development of the baby. If we can deal with our stress and move on, your stress response will recede and your body will go back into balance. But the kind of stress that's really damaging is the kind that doesn't let up, says Susan Andrews, PhD, a clinical neuropsychologist. The mechanisms underlying all this are just starting to be understood. Altered function of the placenta, allowing more of the stress hormone cortisol to pass through the baby, may well be important, as may be the function of the maternal immune system. If a mother is stressed over a longer period during pregnancy, the concentration of stress hormones and amniotic fluid rises, as proven by an interdisciplinary team of researchers from the University of Zurich in cooperation with the University Hospital Zurich. These researchers have discovered that physical stress to the mother can change the metabolism in the placenta and influence the growth of the unborn child. According to Dr. Lee Ellis of Minot State University, maternal stress hormones such as cortisol, adrenaline, and corticosterone cross the placenta. Once they get there, these chemical messengers stimulate the baby's own flight-fight responses and also interfere with the production of sex hormones, especially testosterone. Interestingly, he notes the connection between a stressed pregnancy and left-handedness in the child. Left-handedness is influenced by testosterone levels. Dr. Alicia Davis and her colleagues at the University of Denver have spent years studying the effect pregnant women's stress reactions have on the baby. One hormone Dr. Davis has focused on is cortisol, which the body produces and passes through the placenta to the unborn child. Cortisol plays an important role in regulating the maturation of the fetus, such as lung development, says Davis. These stress systems in the body aren't just there to cause damage or harm us. A pregnant woman can expect her cortisol level to naturally increase by 2 to 4 times. But when they studied expecting mothers with cortisol levels consistently higher than normal early in the pregnancy and their newborns, Davis and her colleagues made a startling discovery. The infants displayed a much higher sensitivity to stress than other babies. After birth, every baby gets its blood drawn by the hospital, says Dr. Davis. The babies of the mothers in the study displayed higher levels of cortisol themselves in response to the stress of having their blood drawn. These babies were having a bigger stress reaction, she says. As these babies grew from infancy to toddlerhood, they exhibited heightened levels of anxiousness compared to other children. Dr. Davis says, "In our lab, we presented the 2-year-olds a series of challenges such as exploring a room with a balance beam or having a stranger enter the room and roll a ball to them. These toddlers consistently showed more fearful behaviors in response to what are standard laboratory measures. Instead of enthusiastically engaging in play with the stranger with the ball, for instance, the toddlers would instead stand frozen by the wall or run back to their mothers. Dr. Davis says they showed more fearful expressions than normal. By the time the children were between ages 6 and 9, MRI scans revealed that the children's amygdala, the section of the brain associated with the human response to frightening stimuli, were larger than normal. Not only are the mothers reporting that these children show anxious behavior, such as being scared of going to school, but we can see differences in the way their brains have developed, says Dr. Davis. The next step for Dr. Davis and her colleagues is to observe the children as they enter adolescence, when many mental health disorders such as depression begin to emerge. The study highlights the importance of keeping both a healthy and sound mind for expecting mothers. Dr. Davis says, "We don't pay attention to a woman's mental health during pregnancy the same way we do other areas such as their nutrition." According to Dr. Thomas Verney, an expert in pre- and perinatal psychology, there is simply no doubt about it that stress is destructive. He says it's destructive to you, it's destructive to me, but it is especially destructive to babies in utero. One of the first things we need to realize is that every second of intrauterine life, 50,000 new neurons are being formed. 50,000 in a second. Dr. Verney even says it's difficult for him to wrap his mind around it, but it's a fact. He says that it's important to know that because by the time you are born, you have approximately 100 billion neurons. We have as many neurons in our brains when we are born as there are stars in the Milky Way. A huge number. And in order to get that huge number, of course, you need to have a lot of neurons being born every second. He says that the reason that this is important is because those neurons are very, very vulnerable. There are millions of them being produced every hour, and they are very immature and they can be easily destroyed. And so one of the things that happens that when a woman is undergoing stress or depression or anxiety, all of those strong emotions have in the long run the same effect on the brain, which is that you have a lot of cortisone produced. And so one of the things that happens when a woman is undergoing extreme stress or depression or anxiety, any of those strong emotions, they all in the long run have the same effect on the brain because it causes a lot of cortisone to be produced. And that's produced by the adrenal cortex, which is sort of the outer layer of the adrenal gland. And the adrenal gland is a small gland that is on the top of the kidneys. With cortisone, in small amounts, it's just fine. It gets you active. It gets you in the flight-fight position, biologically speaking. In a brain that's just developing, the problem with all the cortisol being produced is that neurons are being produced from the center, moving up towards the cortex, towards the outer layer of the brain. We have 6 layers of neurons in the cerebral cortex. And the one that's outermost is the one that we do most of our thinking with. So all of these 50,000 neurons are exploding in the middle and moving up towards their destination, which is genetically programmed. He says, let's assume that you have a neuron in the center of the point where the brain is just starting to develop, and it's destined to go from point A to point X. That's its destination, genetically speaking. That's where it's supposed to go. Every neuron knows where it's supposed to go. But if you have too much cortisone, or if you have too much nicotine, if you have too much of any of those substances that people often take for recreational purposes, either inhaling or smoking or whatever, if you have too many of those substances, they get in the way of the neurons reaching their predetermined destination. So what you may have is that neuron that we described going from A to X does not go to X. It might go to Y or C or D or anywhere else, but it will not reach X. And so what you have is thousands and millions of neurons which do not reach their predetermined destination. So the original blueprint that was sort of destined genetically for us will not happen. So if there is too much stress, then it will actually interfere with the wiring of the brain. This is an important takeaway, he says. So that baby will be born with their brain already impacted by this stress. And if the brain is not functioning properly, then thinking, feeling, behaving, acting, all those things will be off. So it's important to realize that one of the worst things that stress can do is interfere with the wiring of the brain. And the next thing to remember is that the stress pathways can become affected as well. Dr. Verney says to imagine that you are crossing the street and suddenly a huge truck comes your way. You get scared, and so that burst of recognition that a truck is coming your way, plus the visual impact of the truck, will go to different centers in the brain. And so the amygdala, which is where all the new information comes in, it's like the gateway to the brain, gets its stimulus that there is danger outside, will send signals to the hypothalamus, which sends signals to the pituitary gland, which then sends signals to the adrenal cortex. This is called the HPA axis, which stands for hypothalamus, pituitary, and adrenal. And so the amygdala tells those different tissues to produce various hormones, which tell the adrenal cortex to produce cortisone. When there is enough cortisone in the blood and the danger is over, everything goes back to normal. The hippocampus puts the brakes on and creates what's called homeostasis, or balance. So the amygdala stimulates the hypothalamus, the hippocampus puts the brakes on. And when that homeostasis has been achieved, everything goes back to normal and no more cortisone is being produced. Now, if a woman experiences acute stress, for example, if she's just heard that her father's very ill, or he's been in an accident, anything suddenly frightening, then there will be this outpouring of cortisone for several minutes, perhaps hours. Another possibility is if a woman is chronically anxious, depressed, worried, stressed, or perhaps a young woman is unmarried and she doesn't know how she'll be able to support her baby or whether she'll be able to keep her baby or not. She may even be smoking or drinking in order to help allay her anxiety. It's a really difficult situation, and it can cause the destruction of neurons. And if a woman hears a lot of frightening stories, because we humans are able to think and imagine, she can begin producing her own frightening scenarios. And as Dr. Verney says, we don't need a truck coming down the street for us to produce all the HPA axis stimulation. All we need is a frontal cortex, temporal cortex, or any part of the brain producing fearful images. And the more that a woman worries, the more the amygdala is pouring into the hypothalamus, which then stimulates the pituitary and the adrenal axis. And you have more cortisone being produced. So this can be a problem in pregnancy when we are dealing with either chronic or acute stress. And Dr. Verney feels that this is really important information that he wants to communicate because it's absolutely essential to help reduce our stress. Ann Borders, MD, who works in the Obstetrics and Gynecology Department, Division of Maternal Fetal Medicine at North Shore University Health System, says, there are some data to show that higher chronic stressors in women and poor coping skills to deal with those stressors may be associated with lower birth weight and with delivering earlier. Chronic stress can also contribute to subtle differences in brain development that might lead to behavioral issues as the baby grows. Constant stress can alter the body's stress management system, causing it to overreact and trigger an inflammatory response. Inflammation, in turn, has been linked to poorer pregnancy health and developmental problems in babies down the road. According to the March of Dimes, a growing body of research demonstrates that stress before and during pregnancy is associated with poor birth outcomes and subsequent poor health outcomes for children. Maternal stress has also been associated with increased rates of infant mortality, low birth weight, and preterm birth, all of which may have long-term consequences for health and development throughout childhood to adulthood. Some studies show that high levels of stress in pregnancy may cause certain problems during childhood, like having trouble paying attention or being afraid. It's possible that stress may also affect a baby's brain development or immune system. British expert Dr. Alan Watkins says, as to whether babies are sufficiently well developed to experience what we understand as stress, stress exists independently of the cortex, the thinking part of the brain. If thinking is not involved, this also suggests that a baby can suffer from stress transmitted from the mother at a very early stage of development in the womb, while the brain is still at a comparatively rudimentary stage. Prenatal psychologists and progressive obstetricians think that it is the possible flooding of an immature fetus's system with alarm alert hormones that may produce a consistent state of over-alertness and reactivity similar to an adult in a stressful situation, like a taxi driver permanently stuck in an inner-city traffic jam. The fetus's developing system organizes itself around the environment it finds itself in. If it attunes itself to a repeatedly stressful uterine environment, it will be physically and neurologically primed to be this way outside of the womb as well, explains Dr. David Chamberlain, an expert in birth psychology. One study published in the American Journal of Obstetrics and Gynecology back in 1941 found that the whole autonomic nervous system of babies born to mothers who had been very stressed during their pregnancies were unstable. They showed greater than usual changes in heart rate, their blood vessels were very prone to widening and shrinking, and they were also more likely to show rapid changes in their breathing rate, all healthy reactions to sudden stress, but not reactions that should be present in a child or an adult all the time. The brain is sensitive to experience throughout life, but experiences during the critical prenatal and early postnatal life organizes the brain, says Dr. Thomas Verney. I want to emphasize that most women who have serious stress during pregnancy can and do have healthy babies. It's just very important for them to get extra support and care for themselves as much as possible if they are experiencing serious kinds of stress. Serious kinds of stress include negative life events such as a divorce, serious illness or death in the family, or losing a job or a home, catastrophic events such as hurricanes or terrorist attacks, long-lasting stress caused by financial problems, abuse, serious health problems or depression. Some women may face stress from racism during their lives. This may help to explain why African American women in the United States are more likely to have premature and low birth weight babies than women from other racial or ethnic groups, the March of Dimes explains. Post-traumatic stress disorder, PTSD is when someone has difficulties after seeing or experiencing a terrible event, such as a rape, abuse, a natural disaster, a terrorist attack, or the death of a loved one. People with PTSD may have serious anxiety, flashbacks of the event, nightmares, physical responses like a racing heart or sweating when reminded of the event. As many as 8 in 100 women may have PTSD during pregnancy. Women who have PTSD may be more likely than women without it to have a premature or low birth weight baby. For some women with extreme stress, they may turn to using coping mechanisms such as smoking cigarettes, drinking alcohol, or taking recreational drugs. These coping mechanisms can, of course, put their babies and themselves at higher risk for complications. So I'm just going to stop and take a breath here, because as someone that has experienced PTSD and has had stressful pregnancies, some of this information feels very heavy, and it is potentially guilt-producing as a mother, which only makes our stress worse. We all do the best we can in the moment, given the tools that we have at hand. And we will be discussing ways to alleviate stress in the next episode. And again, if we incur stress in our pregnancies, we can still give birth to a happy, healthy baby. We just need to really take greater care of ourselves and alleviate that stress in the best way we can. So now, how does stress affect labor? For one, if a woman is constantly hearing stressful stories and negative stories by the people around them concerning her ability to give birth, or if she has a care provider whom which she shares, I really want to have a natural birth, and that caregiver says, well, you can try to give birth without an epidural, but I really don't think you're going to be able to do it. That can really undermine her belief in herself and her ability to give birth naturally. Again, there's so much stress and fear surrounding pregnancy that it's really important to find ways to alleviate that stress and to get good education and information to help clarify some of those myths or concerns that are out there that people love to share with us when we're pregnant. And if you think about it, if a woman's in labor and she doesn't know what to expect because maybe it's her first baby and she gets to the hospital and she's in triage, and maybe unfortunately she happens to get a very grouchy triage nurse, which sometimes can happen. If she doesn't know what to expect, her mind is going to go to all the stories that she's heard. And if all she's heard is that this is going to be the most painful, worst experience of her life, if she's had multiple strangers stop her and tell her all their horror stories, that's what her mind is going to go to because it has no other point of reference. And in that, she can become afraid. And if those emotions and those stories are powerful enough, her body will respond as if it's actually happening. Our subconscious mind cannot distinguish between something that's actually happening to us and something that we're imagining vividly with a lot of emotion. And a woman is already in somewhat of a vulnerable state when she's getting ready to give birth. If she becomes afraid, the first place that can tighten in our bodies when we're really afraid is our pelvic floor. And it's part of that fight or flight stress response. But when we're giving birth, we need our body to be relaxed and unfold. And as Nancy Griffin explains, the uterine muscles are beautifully designed to deal quite effectively with danger, fear, and stress in labor. The uterus is the only muscle in the body to contain within itself two opposing muscle groups, one to induce and continue labor, and another to stop labor if the birthing woman is in danger or afraid. Emotional or physical stress will automatically signal danger to a birthing mammal, and her labor will slow down or stop completely so that she can run to safety. In modern times, this can go a bit haywire because we can't run from our fears, which may include the horror story our best friend told us about her birth, or even comments or stories from our hospital staff or physician. Instead, we may release adrenaline, which causes the short circular muscle fibers in the lower third of the uterus to contract. These muscles are responsible for stopping labor and closing down and tightening the cervix. The result is that we will literally stew in our own adrenaline. At the same time that the long, straight muscle fibers of the uterus are also contracting to efface, which is thin, and dilate or open the cervix. The short circular muscle fibers of the lower uterus are also contracting to keep the cervix closed and fight the labor. The result? The very real pain of two powerful muscles pulling in opposite directions each time the birthing mother has a contraction. Nancy Griffin further states that by learning to deeply relax mentally, physically, and emotionally, actively dealing with fears about birth, and choosing a birth environment that feels safe and protected, birthing women will not have to experience the traumatic pain caused by the fear tension pain syndrome. In the 1920s, Grantley Dick Reed, MD, described what has become known as the fear tension pain cycle. He suggested that fear causes a woman to become tense, and that tension increases pain. The increased pain, in turn, increases fear, and the cycle repeats. Dr. Grantley Dick Reed suggested interrupting this cycle in two ways: reducing fear by educating women about what's happening during childbirth, and to reduce tension by promoting relaxation and thus reducing pain. The greater a woman's ability to relax and trust the process of birth, the easier it is for the circular muscle fibers to remain passive and the cervix to thin and open more efficiently. This can make for a more gentle and peaceful labor and birth experience. Once the baby is born, it is important to facilitate skin-to-skin contact immediately after birth. This helps regulate the hormones within mom and baby. It helps regulate baby's breathing and their temperature, and it's just a gentler, less stressful entry into the world. They've described it as the golden hour, and ideally that baby experiences delayed cutting of the cord to allow the baby to get the full blood volume and all of the stem cells that are available to him or her. And the benefits of that also help increase the baby's iron stores. This immediate skin-to-skin for at least an hour or two really helps to facilitate attachment and bonding between mother and child. Immediately after birth, however, not all women are overcome with joy and feelings of love for their newborn. A mother may be processing everything that just happened to her during the labor and birth. This can be normal. She may need time to get to know her baby and develop a relationship with her child. Like all relationships, falling in love and bonding doesn't always happen right away. While giving birth is an amazing experience, even the smoothest of births requires time to process and integrate. Women often need to replay and share their birth story many times to help facilitate this process. If a mother has had a difficult or challenging birth, she will need more time for this work. She may need to talk with someone that can listen in a supportive, non-judgmental way, and may benefit from seeing a therapist or caregiver specializing in pregnancy and birth. Unfortunately, it is estimated that 33 to 65% of mothers experience a birth-related trauma, and 2.5 to 9% of mothers experience birth-related post-traumatic stress. Birth can be traumatic for partners as well, which is often overlooked. Birth can be traumatic for babies, especially if caregivers and hospital protocols are not sensitive to the needs of babies and families, as our medical system has historically been. Pre- and perinatal psychologists are concerned that the rates of birth trauma for babies are epidemic. And I want to emphasize that, again, relaxation practices, bonding with the baby during pregnancy can really help to mitigate pregnancy complications and trauma for babies. There are practices that can help. Once a baby is born, the mother's body experiences a sudden and swift change in hormones immediately after the birth of the baby and with the release of a placenta. This abruptly ends the source of the pregnancy hormones the placenta has been supplying the mother. A new set of hormones floods her body as her milk comes in around days 3 to 5. These hormonal shifts, combined with the stress of giving birth and caring for a new baby, sleep deprivation, as well as a sore and tender body, can cause a mother to feel weepy, overwhelmed, irritable, and emotionally fragile. This is known as the baby blues. Generally, the baby blues can be felt within the first couple days after the birth. They may peak around 1 week and taper off by the end of the second week postpartum. While it can take a new mother by surprise, the majority of women experience at least some symptoms as she is working through all the changes the birth of her baby brings. These changes include hormonal changes. After childbirth, women experience a big drop in estrogen and progesterone hormone levels. Thyroid levels can also drop, which leads to fatigue. These rapid hormonal changes, along with the changes in blood pressure, immune system functioning, and metabolism that new mothers experience, may be a factor in triggering postpartum depression for some women. Women also experience physical changes. Giving birth brings numerous physical and emotional changes. Women are dealing with physical pain after giving birth and feeling like their body is not their own anymore. There is tremendous pressure in our society for women to return to their pre-pregnant body as quickly as possible. It can leave women feeling insecure about her physical appearance and sexual attractiveness. Many women are also too exhausted from caring for their baby to be interested in sex. Another factor is stress. The stress of caring for a newborn can also take a toll. New mothers are often very sleep deprived. In addition, she may be feeling overwhelmed and anxious about her ability to properly care for her baby. She can feel inadequate and helpless even at times. These adjustments can be especially difficult for first-time mothers who must get used to an entirely new identity. She may feel isolated since she's alone at home, caring for her baby while others are at work. It can feel like her old life is passing her by. It's important to note, too, that even the best of relationships can become strained with the demands of caring for a new baby, along with sleep deprivation that goes along within it. It can leave parents feeling sensitive, overwhelmed, and exhausted. It's all too easy for couples to turn their frustrations onto each other and snap at one another. Keeping the lines of communication open helps to reduce stress and makes the relationship stronger. Many things change following the birth of a baby, including roles and expectations. It's important for partners to avoid assuming that their partner knows how they feel or what they need. The baby blues and the stress of the transition of life with a new baby are perfectly normal. But if the symptoms don't go away after the initial few weeks after the birth of the baby, or if they get worse, a woman may be suffering from postpartum depression. Unlike the baby blues, postpartum depression is a more serious problem and one that should be addressed. In the beginning after the birth, postpartum depression, sleep deprivation, and normal baby blues can be difficult to distinguish from one another. They share many symptoms, including mood swings, crying jags, sadness, insomnia, and irritability. The difference is that with postpartum depression, the symptoms are more extreme, such as feeling unable to cope or incapable of caring for the newborn. Women experiencing postpartum depression can also experience dark or suicidal thoughts. There's no single reason why some new mothers develop postpartum depression and others don't, but a number of interrelated causes and risk factors are believed to contribute to the problem. There are several factors that can predispose someone to postpartum depression. The most significant is a history of postpartum depression, as a prior episode can increase her chances of a repeat episode to 30 to 50%. A history of non-pregnancy related depression or a family history of mood disturbances is also a risk factor. If a mother feels as if her baby's birth did not go as she had hoped and dreamed, especially when she was planning an unmedicated natural birth, or if her birth was traumatic for her or her baby, or if she felt bullied and unheard during her labor, she can be at a greater risk for postpartum depression. Other risks include social stressors such as lack of emotional support, an abusive relationship, and financial uncertainty. I was shocked to learn that 1 in 4 women is back to work within 2 weeks of giving birth because they cannot afford to take any additional unpaid time away. As a result, new moms are back to work before they've been able to recover fully from giving birth and before they've been able to establish breastfeeding routines. A woman that has experienced prenatal depression during her pregnancy may also be more inclined to experience postpartum depression as well. The risk also is significantly increased in women who discontinue medications abruptly for the purpose of pregnancy. Something that often gets overlooked is that a mother can be at risk for postpartum depression up to a year or 2 after the birth of her child. Partners can experience postpartum depression as well. According to an article in the Maternal and Child Health Journal, the prevalence of postpartum depression significantly increased from the lowest cumulative stress exposure class to the highest. Mothers who reported more than 5 stressful life events had the greatest prevalence of postpartum depression, 43.4%. We categorized 13 stressors into 4 groups: financial, relational, trauma-related, and emotional. The average number of stressful life events was significantly higher among mothers with postpartum depression than those without postpartum depression. This study demonstrates that along with certain high-risk demographics, the type, number, and intensity of stressful experiences during pregnancy significantly impact the likelihood of developing postpartum depression. The likelihood of postpartum depression is particularly great among mothers reporting high levels of relational stress, demonstrating the importance of social support for pregnant and parenting women. Efforts to effectively prevent and manage postpartum depression should focus not only on diagnosing and treating the clinical illness, but should attempt to address and understand the potential sources of stress that can incite and exacerbate this condition for mothers. Dr. Borders said, "We know that we want to think about how to reduce unhealthy stress and find ways to help women have better coping mechanisms to deal with stress in their lives." She also stresses, you shouldn't feel guilty about stress, but you should try to control it as much as you can. I know that this is a lot to take in. Parenthood is just stressful sometimes. It's almost wonderful experience in many ways, but it's just stressful. And honestly, it was a bit stressful just to sort through the information and formulate my thoughts for this podcast. I had to stop a few times. It took me almost a week to write this because the information hit points that are close to home to me, especially since, as I've mentioned, I've experienced stressful pregnancies, PTSD, as well as prenatal and postpartum depression. Additionally, spending the last week preparing for the hurricane and hoping that my child's father would be okay in the Caribbean during it, as well as dealing with the cone of uncertainty regarding where this hurricane was even going to hit, it has really hit home to me as a reminder how stress can impact us and our relationships and our bodies. If you made it to the end of this stress-filled podcast, a little stressful, please join me in the next episode. There is help in the form of resources, techniques, and coping skills, because again, that has really become the focus of my practice. Not only helping women to have a smoother, peaceful labor, but to really help women to mitigate stress during pregnancy, during the labor, postpartum, and in our journey of parenthood.
For more great conversations like these, or to find out more information and access Michelle's library of amazing guests, go to birthease.com/podcast. For more information on the Birthease method, Michelle's classes, meditations, and other services, go to birtheaseservices.com.